question. We'll keep it as informed as we can. So the four people who will be speaking are Breda Quealy, her son Barry Quealy, Shannon Carey, and Donal McCann. And all four have von Willebrands. So I'll start perhaps with asking each of you what age you were when you were diagnosed with von Willebrand disorder, and along with that, was there a family history, or were you the first in your family to have von Willebrand's disorder diagnosed? Breda, start with you.
Yeah. I was 35 when I had a diagnosis. Now, I had no family history. I was the first after having 35 years of a lot of bleeding, a lot of problems. And I think it was, in the end, I had a hysterectomy at 35 because doctors just got fed up with me, didn't know why all this bleeding was going on. And it was, even after the hysterectomy, 10 days later, I got another hemorrhage. And it was then, I think, somebody somewhere decided there's something going on here, and I was sent off to be tested, and that's when I got my diagnosis.
Okay. Barry, obviously you can't say you've no family history, but...
Well, I believe I was number two. Mum might correct me on that. There's been quite a few people in the family actually since I was diagnosed, but a good few years later. I was, I think, 6 years of age. I think 1986, 1987 I was diagnosed. I was initially, well, I've been under the impression that I have type 2B for quite a long time, but there's a possibility I may be in the same camp as Mum with type 2M. We don't know for absolutely certain yet. I have to go in for further testing and see where we go. But yeah, that's where we are. Like, since then, both of my children, 3-year-old and 6-year-old, have been diagnosed as well in the fairly recent past. And there's been various cousins, aunts after that, you know.
But basically, if your mum hadn't been diagnosed, then you could have perhaps waited years yourself to be diagnosed. Would that be fair?
I'd say it's almost certain. Almost certainly. I may never have been diagnosed until maybe my 20s, or no, I did have a bit of an accident-prone youth, so I tended to have quite bad cuts and quite bad bleeds from various different misadventures. So someone might have noticed that something was up, that the bleeding wasn't stopping, and I may have gotten a diagnosis through that avenue. But yeah, getting diagnosed at 6 was probably preempted a lot of trauma. Could have been worse if I wasn't diagnosed at that time, you know.
And again, if you hadn't been diagnosed, it's almost certain your two sons or your two children wouldn't have been diagnosed.
Oh yeah, absolutely. It was, there was a lot of provisions put in place when my fiance was due. There was a lot of provisions put in place, a lot of investigation, just making sure that everything was lined up and ready to go before they were born. Just precautions. And obviously the diagnosis was lined up for as soon after birth, or should I say testing for diagnosis was lined up as soon after birth as was safe and practical, really. Because it's just good to know.
Shannon, what about your diagnosis? What age were you when you were diagnosed?
So I was diagnosed when I was a baby, but I didn't get my full diagnosis until around the age of 7, just due to fluctuating levels. But the main reason why was that I actually have 3 different bleeding disorders within the family. My dad's side has haemophilia. My mum was diagnosed with platelet defect when she was in her 30s, due to the fact that my oldest sister Aoife, when she was very young, she came up with bruises on her back, and they originally thought it was going to be a type of blood cancer, leukemia, just the way the placement was. So she got brought in for testing, and they saw that she had platelet defect. So of course my ma turned to my dad going, "That's your side of family," but the doctor was like, genetics don't work that way. So that's how she got her diagnosis. So then when me and my other sister were born, we both got straight away tested, and that's when I came out with von Willebrand's.
Okay.
Yeah.
And Donal, what age were you when you were diagnosed?
Like, my official diagnosis was when I was about a year old, but they were fairly confident because I was born bleeding and I spent the first 7 days in neonatal care bleeding. They were fairly confident I had a bleeding disorder. Then when I was 8 months. Like, I had a lot of bleeds up to the 8-month mark, but at 8 months, I had a very, very bad bleed. Lasted a couple of days, went into hospital, and I was in there for a couple of days, and they wouldn't treat me. My mother knew the history of von Willebrand's through my father. My father eventually came in and gave all the doctors a bollocking. They treated me, and I stopped minutes after they treated me. So from the 8-month mark, they were fairly convinced. And then when I was a year, the results came back that I had type 2A with low factor VIII levels as well.
Okay. So moving on to all of your experiences living with von Willebrand disorder. So this time I'll start with you, Shannon. So what have been your main experiences of living with von Willebrand's, the main impact of von Willebrand's disorder on your life to date?
Well, when I was a child, like all of you have said, it's like I was just covered in bruises constantly, nosebleeds, like the everyday kind of thing. I remember one time I had a rock thrown on my head, and it was like a scene from Carrie. Like, it was just, I was drenched, but that was one of the main things. But then once I hit puberty, it was mainly my periods. Like, right from the age of 11, I had the heaviest periods ever. Like, it was up to 10 days. And I was going to camps and stuff like that, and I wasn't even able to experience the full camp experience due to the fact that I wasn't even able to move. And due to that, then it was like massive iron deficiency. So it was kind of hard. So it was a matter of going on to birth control from the age of 11, and up to now I've been on about 4 different forms of birth control because it was a matter of experimenting. So it ended up, we got a hormonal transplant put into my arm, and it stays there for 3 years, and it actually meant now I don't have a period at all, which meant I completely alleviated the whole period like symptoms, and now I'm no longer iron deficient or anything. So pretty good so far.
And when you were iron deficient, were you getting iron supplements?
Yeah, I was on iron tablets most days. But as a teenager, I was very bad for taking them. I was very bad for the pill as well. That's the reason why I got taken off the pill, because I was never good at remembering it. So that meant that I was constantly like, I was either pretty good or pretty iron deficient. So it would have affected my studies during these times, because like you kind of need to be awake and alert during these like exams and everything.
Okay, Breda, I'm going to come to you and ask you the main impact on your life, your experience of von Willebrand's.
Are you a pre-diagnosis, is it, or?
Yeah, I guess pre-diagnosis, yeah.
Yeah,
Because
well,
you
I
said you were
suppose,
35 when you were diagnosed.
yeah. Well, I suppose as a child, like I had nosebleeds, and nobody knew the reason why I was having all these nosebleeds. And then as a result of the nosebleeds, I suppose it was and Shannon said, iron deficiency. I used to get terrible styes in my eyes, infection in my eyes. I suffered a lot with sore eyes and infection, all the rest. And then when I went into to be a teenager, then it started with the periods and infection, and what led from very heavy periods up to 10, 14 days I'd have them. I started getting infection in my teeth, and getting abscess, and my teeth had to be extracted, and then the whole saga of that, having a tooth extracted from me was having it packed and having it stitched. Well, that was later when I was a teenager, that they were used to be stitched, or that I just bleed, I'd get infection, and really I couldn't eat solid food for about 2 weeks until it eventually healed. Antibiotics, trying to get over the infection. And then I suppose when I had, doctors never took any notice. Oh, your heavy periods, that's normal. As you get older, have a baby, you'll be fine. But then when I had my first baby, it was bliss when I was pregnant, because I had no periods. I had, there was no problem with iron or anemia or nothing. It was absolute bliss until now. I had no problem with the actual birth. I was fine. About 2 months later, it was just like deluge again, like. And I think after going back to gynecologists, they didn't know why I was having all this hemorrhaging. So I had a womb repair. I said that was the reason why I was having this hemorrhaging. That wasn't a success. I got an infection, very bad infection, and it took about nearly 2 months before eventually the wound healed up and the infection. And then I had a second baby, Barry, and that all went fine, except the same thing about 6 weeks, 2 months after he was born again. And then I ended up with a perforated ulcer and ended up in hospital and had to get 3 blood transfusions because of the hemorrhaging. And I was about to come home when I got, or sorry, with the internal bleeding that time. I was about to come home when I got a hemorrhage. Had a D&C and was told that I had a fibroid that was dangerous and I would have to have a hysterectomy down the road. But I was home 2 weeks when I got a very bad hemorrhage, rushed to hospital and had to have an emergency hysterectomy. And as I said then, 10 days later, I had another hemorrhage and had to have surgery again. Couldn't find out where's the bleeding coming. It was coming from between 2 stitches, is what I was told at the time. And I was in hospital for 2 months because they wouldn't let me out of bed in case I hemorrhaged again. That was the, antibiotics and waiting for the wound to heal. And then I had the diagnosis after that. And
You went through all that before diagnosis.
Absolutely. I had a tonsillectomy. I forgot that little bit when I was in college when I was 19 and I was home from hospital and I got a horrific bleed. But my GP gave me a vitamin K injection. I was living in the country. And by the time I got to the doctor, I was nearly dead with choking with this clot that had built up. But gave me at the time a vitamin K injection and that stopped it. But there was still nothing. That was when I was 2021 or 19, I think, yeah. But so that was all happened, as well as I lost most of my teeth because as I said, I would get this abscess and then root canal. That didn't work out. And then I'd have to have an extraction. And then it took so long for it to heal up. And I had several dentists along the way, just, sorry, I wouldn't like to treat you again. I don't know why you're not healing, blah, blah, blah. And that was it. But nobody ever said I should go and be tested, or there was nothing. There was just no notice taken of it, really,
So your story is one I've heard before from people, and it's actually a shocking but salutary tale of the importance of diagnosis for von Willebrand's. Now you said that you were 35 and you had heavy menstrual bleeding, so you'd probably gone through, at least 20 years of heavy menstrual bleeding before being diagnosed. Did you check with your mother, with sisters, with other girls that you did you realize that your menstrual cycle was abnormal?
No, you see, I didn't. I took it as being normal until I moved to Dublin when I started working, and I was sharing an apartment with 3 other girls, and that's when I realized that this was abnormal, because they'd be only 2 or 3 days or 5 max, and here I was going on with this. And then then I when I'm back home, I went to my GP, and that's when he told me, look, if you have a baby, that will sort it all.
Yeah, that's
That was about 22, 23.
That's really interesting, because I mean the message that Michelle Lavin was putting out with her Know Your Flow website was really for girls and women to be aware that if your period lasts for more than 7 days, if you're changing a tampon or a pad more than every 2 hours, if you're passing clots larger than €1 coin, that's not normal. And in fact, because von Willebrand's is inherited, Breda, your experience is quite common, because a girl will check with her sisters, with her mother, with her female relatives, and so it's normal, but it's normal within their family, which means they might all have von Willebrand's.
Mm-hmm.
And again, it's not unusual for the treatment to be a hysterectomy or the pill, where in fact at that stage, it's way down the road. I think we had a seminar on women and bleed disorders in 1997. Professor Christine Lee from the UK spoke, and they had an audit of hysterectomies in the UK at the time, and 15% of all the hysterectomies were carried out in women who had an undiagnosed underlying bleeding disorder. So in many of those cases, that could have been prevented. So on to you, Barry. Your experience growing up with von Willebrand's, major problems that you have.
Yeah, I suppose since I was diagnosed at a relatively young age, at six years of age, and mum had her diagnosis prior to that, we were aware it was on the radar what Willebrand's was, what precautions to take. Cyclocapron was every time you had a bump or a scrape, it was cyclocapron straight away. It was almost like a mantra. But it's I said like as I mentioned earlier, I had like quite an active youth. I was recommended when I was diagnosed first never to play hurling, never to play any contact sports, and that didn't really sit well with me. So I kind of just went ahead with it anyway. And it was only later in life when I got to my early 20s that I kind of realized that I'd spent like since I was maybe 8 years of age playing hurling and football with bruising up and down my legs and aches and pains constantly all that time. I just thought it was normal because I'm active and I'm running around and it's a contact sport. I thought everyone had this all the time. It was only when I kind of stopped playing football and hurling and started getting into other non-contact sports like surfing and that I realized that I just wasn't in this. I wasn't aching all the time, constantly. So that was one of the sort of the fringe ones I had. One thing my doctor I remember asked me back again when I was in my 20s, he asked me a question about what it's like to live with a bleeding disorder, what's different about life as a bleeding disorder, was how he framed it, and I couldn't answer because I've absolutely no idea what it's like to not have one. The major things I had were probably the biggest incident or trauma I had is I had a very, very bad cut on my left thumb when I was 17. I cut it on I was playing football outside of the house. A ball rolled into our garage. We had a new garage door installed, and it was sort of a roller garage door that rolled up, and it had two tracks, stainless steel tracks on the side. Just banged my hand off the door as I was walking in, as maybe you would, without noticing, and then it started to feel very weak about a minute later. Went to go inside, and I noticed that I was leaving a trail of blood behind me. The tracks when the garage doors installed, they were never buffed clean. It was just razor sharp, and it had a cut tendon, an artery, and it severed a tendon, an artery, and nerve in my thumb, and had taken a significant slice off the side of it. So there was huge blood loss. So I ended up going into hospital for that. And it was then that kind of the von Willebrand's element kind of came to the fore. I have no solid recollection of how many hours I was inside an accident emergency and while they were trying to get the bleeding to stop. It was definitely 10 plus. The exact details of that are obviously blurry. I lost an awful lot of blood in that instant. But yeah, they had no idea how to stop it. They'd no way to do it. All I'd taken was self-administering cyclocapron, my mother and father providing that. There was no blood treatment forthcoming. There was sort of maybe a drop in communication within our local hospital. Something fell through the cracks, and unfortunately it was me in that instance. And it's entirely likely, even though it was a very serious arterial cut, that it could have been dealt with in a significantly shorter period of time if the right steps were taken. And again, look, I've no idea. I still don't have great use of that thumb. It's always been, that's 25 years ago, and I've still got very limited use of the thumb. That I may have had significantly better use of that thumb by this stage in my life and throughout the last number of years, if the right steps had been taken in the right order and von Willebrand's had been taken a bit more seriously, maybe, You
didn't get any von Willebrand containing factor concentrate
not for a long time. Not for a long time. It was quite a long time. Not an accident emergency. I never got anything inside there. I think I had to go for significant reconstructive surgery, and I did get Haemophilia, I believe.
Yeah.
I believe it was Haemophilia and cryoprecipitate maybe as well. I think actually that was the first time I had Haemophilia at that time. And yeah, that was before going into surgery. I basically pressure and elevation was everything. That was all that was done.
Okay. And that hospital wasn't the haemophilia treatment centre, was it?
It was, yeah.
Yes. Yeah.
Was it? Okay.
Absolutely,
okay.
Yeah.
Okay. And so, Donal, your major experiences with von Willebrand's?
Yeah, I don't really know where to start. I've kind of had every bleed you can kind of think of, and they've repeated for the last 30 years. From nosebleeds, like I still get 3-4 bad nosebleeds a week. The last time I treated for a nosebleed was this week. Joint bleeds, I've had a lot of joint bleeds. I have a lot of joint damage. I slept on my left hand shoulder 3 or 4 nights ago, and I can barely lift my left arm now. It's just the joint damage that's in it. My right knee, I walk with a limp every day. Some weeks are better than others. It just depends on how hard I've been on myself that week, how much jumping down off tractors I've done, how much climbing in underneath machines I've done. It all just depends on the mobility for the following week. Cyclocapron, used to take it like Tic Tacs. I actually have nightmares of a cyclocapron because we used to have to take 2.5 tablets. I think it was 50, or I think it could have been 1,500 milligrams. So I used to have to break a tablet, and the chalkiness of the tablet I can still taste. When you're talking about nosebleeds and things like that, every time I lost a tooth as well, I was in hospital for 4, 5, 6 days, and they just couldn't stop the bleeding. I was on DDAVP from when I was a baby. I used to have a reaction every single time to DDAVP. They never really listened to me, but my skin used to feel like it was on fire, and I used to turn purple. So I used to turn it down myself on the drip, and then the nurse would come in and give me a bollocking over it. But it was the only thing that I could stop my skin from feel like it's melting off my bones. So yeah, nosebleeds were just constant. As I said, I still getting them. My nose was bleeding earlier. The biggest trouble with the nosebleeds was throat infections after them. So if I had a big nosebleed, what we would call a bad one, it would be a 3 or 4 day long bleed. You'd be taking cyclocapron every 4 hours for that bleed for 3 or 4 days, and it wouldn't do a thing. Like, it'd be a hospital job. But because I was in hospital so often, it was obviously my mother that was bringing me in. We used to leave it really long. We used to leave it 3 or 4 days before we go in, because we knew once we went in, we were going to be in there for another 3 or 4 days. And I have an older sister as well, which it wouldn't have been easy for my mother. She was a single mother with 2 kids, having to leave her in neighbours and uncles and aunts and things like that to spend time in the hospital with me and bring me in. And it was usually in the middle of the fucking night. Spontaneous stomach bleeds I had a lot of spontaneous stomach bleeds as well, which I never thought much of them because I don't really remember them that being as severe. But from what I was told, it's just vomited just pure blood out. But now, as a father, I realise how scary that is. Like, if my little one done that, I'd pick her up and run to the hospital. I don't think I'd even think of putting her into the van. I'd be gone that quick. Yeah, the nosebleeds, as I was saying, the throat infections were a big thing after that. Like, I can't remember how much school I lost the whole way through my life. But my mother knows from my leaving cert year, I lost 44 days in school. And out of the school year, I think there's only about 168. So from what she said, that's her figures. So if they're wrong, blame her. But 44 days, like that's massive. And that was the same as every year. Every year was just throat infection after bleed after throat infection, joint bleeds. I think the worst joint bleed, I had 2 really bad joint bleeds, and not just ankles and knees and wrists, and I have them regularly. But the worst one, I dislocated my shoulder and went into hospital. I actually went into hospital about 12 hours after I dislocated it. Just pure ignorance, like, didn't want to go in. And they couldn't get the joint back in. They couldn't pop it back in because the cavity filled with blood. So I was 3 days with my shoulder out, and they were trying to use this. It was like a little, not infrared. What's the thing called where you're checking for a baby? Say, what's it called?
Ultrasound.
Ultrasound vibration massage thing. Was trying to break the clot up so they could get the shoulder back in, but like, that was fucking agonizing pain, like. And it was actually nearly worse when they got it back into place, because once it's out, it's kind of out, and I kind of got used to it being out for 3 days. And when it went back in, like, that's why I got so much damage in my shoulder. And then I was let out from hospital, whatever it was. I think I was in there for 8-9 days that time. I got let out with no treatment, 0 treatment to go home with. Like, so, you know, a couple of days later, the joint was bleeding again. I had a bad bleed into my back as well. I was in hospital for a good 2 weeks. It just traveled, the bleed just swelled up along my spine. I started losing the feeling in my legs and started losing the feeling in my right arm. And then from losing the feeling in my arm, it went to the opposite, where my arm was burning. And I was in a really, really bad way in hospital. Like, I was screaming with pain, but I was on morphine. So I was actually telling them, and I only heard this after from my mother. I actually only heard this about 2 years after, that I was telling them to cut my arm off because the bleed wasn't even in my arm, but it was just whatever way it was pushing on the nerves. But again, left hospital, no treatment. So I only got home treatment when I was 27, like, and it was because I distanced myself from the centre. I was bleeding away a couple of times a week, and it just got to the stage that I couldn't do it anymore. I just was just on the verge. Like, every time my nose started bleeding, and we're talking about a weekly basis, it's embarrassing. Like, having a nosebleed is embarrassing. It's uncomfortable. You can't sleep because the clot goes down your neck. Then you get a sore throat, and then you're sick as well for a couple of days because your stomach's after filling full of blood. You know, and it affects you for a couple of days. And when you see a heavy bleed belong to me, it's really intense. Like, it's like a tap. But there was some days now, I swear to God, that was, you know, I just wanted to finish it because I just couldn't. It used to just get me to just such a high level of anxiety and depression that I just wanted to fucking finish it over a bleed. Like, and it was only because of the bleed. It wasn't because of anything else that was going on. It was just, I was so sick of these bleeds, and it was just, that was the rhythm of my life. Every time I went away on holidays, I'd lose a couple of days because I was bleeding. I didn't even leave the country until I was 22 because of the fucking bleeds. I couldn't go to friends' parties because every time I went to a party and I got excited, I'd have a bleed. I never played sports because I was shy at them anyway, but I'd have a bleed. Every time I'd done anything, every time I was going to have an exam, I'd have a bleed. It was just a rhythm of constant bleeding, and I'm still constant bleeding. I have home treatment, so I know if I have a bad bleed, I can go in and take treatment, and I know for a fact it's going to stop. There's no guessing, there's no wondering if I can actually go back out to work after it, because I know for a fact that if my bleed stops because of the treatment and I slide in underneath the tractor, or if I get down on my hunkers and I put pressure on myself, I know it's nothing. I could do a handstand. That's how confident I am. Well, kind of. But after taking treatment, it has made an incredible difference to me. It has given me the confidence to travel, and like, Fiona's online there. Like, she'll tell you, we have done a couple of trips away together. Every single trip for the E.H.C. or something like that, I've had a bleed. It's just, every time I get excited, every time my stress levels rise, anytime my anxiety levels rise up, I get a bleed. So the confidence of knowing that I can bring treatment with me and just take it, and that's the bleed sorted. Like, even on a night out, you know, I've often come home to take treatment, to head back out, knowing that I'd be grand, because obviously if you're having a couple of drinks, you know, alcohol is a blood thinner. It would just never stop. I've often had to come home from nightclubs, pissed, but still, you know, I was going to have a good night, you know, but like, that's not even, on a serious note though, the joint bleeds and things like that is, for me, the worst. Like, a nosebleed is fine, a tooth bleed, gum bleed, you know, even a muscle bleed is fine because you get over it, like, and you don't remember it then that so much. Well, I don't anyway. But a joint bleed, it's just a pain that carries on for years and years after. Like, I injured my knee when I think I was only 16, 17 off a motorbike, and my knee is the really bad one now. It's the one that every day I get up, or, you know, I have to limber out before I put on my socks. Like, there's no way I'm going to bend my knee in the morning to get my socks on unless I walk around for a little while. If I come in from a long day's work and if I sit down on the couch, if I sit down for more than 15 minutes, I can't fucking straighten out. I cannot get up. Like, it's going to take me a good 5 minutes to get up to go in and get myself a cup of tea or something. So that's what I always say. If I get down on the couch, please, if you're looking for, if you're asking me to do something, or if you're looking for me to do something, just do it before I get down on the couch, because I'm not going to be able to go back up. So yeah, so the joint bleeds, and the worst part about the joint bleeds is, I feel like I didn't have to have all these joint bleeds. Like, I know I caused them. 90% of them were from injury. I know that, and I take responsibility for that. And I've suffered it, and I've paid the price, and I've suffered it for it. But I feel like I should have been given the treatment from a very young age to come home with me, so I could, if it starts rebleeding within a couple of hours of getting home from the hospital, I could treat. If a couple of days later, if I'm trying to get back out to work and it starts bleeding again, I should have been able to treat. But what was happening was, because I spent 4 or 5, 6 days, 2 weeks, fuck knows, in the hospital. And when I get home, I'm tired from the hospital. Like, you guys will know, it's tiring being in the hospital. You just want to get home to your own bed. You're not sleeping at night because they're fucking checking you every couple of hours. So when it does rebleed, I was like, fuck, no way am I heading back in for this. No way. So I used to just let it rebleed and just try stay off it. But I feel like I was let down a little bit. I feel like I should have been on treatment a lot earlier than I was.
So Donal, that segues into I want to talk about current treatment. Now, what we've heard from the four of you, 4 different sets of experiences. So normally when people talk about von Willebrands, they very often talk about nosebleeds, about bleeding from cuts, about dental bleeds, about heavy menstrual bleeding in girls and women. I think, Donal, it was very interesting hearing your experience, because a lot of people with von Willebrands don't get a lot of joint bleeds. You've had a lot of joint bleeds. But I want to talk now about current treatment, and I'm going to come back to you briefly, Donal, just on this. I mean, the new von Willebrand guidelines, which are out there, which have been published in the last few months from the WH, the NHF, the American Society of Haematology, and the ISTH, that these are consensus global guidelines. And one of the points they make is that people with von Willebrand disorder who are having serious and frequent bleeding should be considered for prophylaxis. So given the fact that you have you find the treatment very, very good, you're on demand at the moment, and given your history of bleeding, you're obviously getting serious and frequent bleeding, and given your job, which is quite heavy physical work, do you not think that you should be considering prophylaxis in the future?
Yeah, so I've had this conversation a lot, and it's something that I'm starting to lean towards. I've had this conversation with yourself. I've had it with my haematologists. I've had it with everybody at this stage. I was actually, when I was 27, I think they kind of more so pushed me towards prophylaxis. But I didn't feel like I needed it. I felt like I'd be able to handle it myself on demand. I know when a joint is bleeding or when it's starting that I can just take the treatment. Maybe there's a few more micro bleeds happening that I don't know about, and I'm confusing it for pain. I have been thinking about that a lot recently, following our discussion actually. And I think actually somebody else here, I think Jim was telling me, and I think Kieran or one of you boys could have been telling me about being so stiff in the mornings and being in so much pain when you first get up and things like that it actually starts to go away with the prophylaxis, or it makes a big difference. So yeah, maybe my mind is getting pushed towards prophylaxis, and I suppose I should have probably taken it when they offered it.
Well, I mean, I think it's something you can consider. You've got used to on-demand treatment now, but I would make the point to you that I think, and maybe Kieran or Jim or some of the guys with haemophilia would like to comment on this, but even with prophylaxis for adults with severe haemophilia, that's really only come into vogue in the last 10 years. Prophylaxis has been around since the 80s, but really it's only in the last 10 years that most of the adults in Ireland with severe haemophilia have been on prophylaxis. And a lot of them would have said what you've just said. Well, no, I know when I'm getting a bleed, I can treat quickly on demand and it's fine. I don't need prophylaxis. But you actually don't see the benefits of prophylaxis until you've been on prophylaxis for a period of time. And then you're down. Now, I think several of the people with haemophilia will be on prophylaxis. So you certainly see a big difference from being on prophylaxis, but not just joint bleeds. You mentioned yourself, you're still getting nosebleeds most weeks. They should surely take care of that as well.
Most days. Yeah, no, look, I have been thinking about it, but you have to remember that my mindset was completely backwards for this. When even before I got my on-demand treatment, I was in hospital for days at a time without even getting treatment. I was left sitting on tables. I was left sitting on chairs, bleeding. I had to do the only reason I ended up getting the treatment one night I was there, I went in with a bad bleed. I'd been working in the mines. I came up from surface bleeding all day, and I said, fuck it, I'm going to have to go in because I have a 5-day shift. So I was going in for 5-night shift. So I said, geez, I better go in and see if they'll give me treatment. I was in there for 5, 6, 7 hours before they gave me treatment. I was pumping blood. I had big wads of bloody tissue and clots all around me. I still have the pictures on my phone, and it was bad, and I wasn't trying to be discreet about it as I usually am. Like, some people wouldn't even know I'm bleeding because I'd be trying to be discreet. But I had to kind of stage a dirty protest. And then the hematologist came in and told me it was only a nosebleed. So, it was, I had always been pushing and asking for this treatment because I knew that Y-Late was going to stop me straight away. And it still was always a case of, I went into hospital with a bad bleed, joint or whatever it was. They would bend me around on the tables trying to get x-rays. They would have physiotherapists pulling at my leg, pulling at my ankle, pulling at whatever it was that was in pain at the time without giving me treatment. With haemophilia, the first protocol is treat. It was never that way with me. It was nearly the last protocol. I actually offered to pay for my treatment. It was that I just needed it that much, and they weren't giving it to me. I thought that if I offered to pay for it, they might be able to give it to me. So if you can understand why I was hesitant to go on to prophylaxis when I've been made feel like I wasn't entitled to it for 27 years.
Okay, I'm going to move on to Barry and ask you about your current treatment.
Current treatment, there's none. It's entirely in times of injury, trauma, anything happens, anything goes wrong. Cyclocaprin is, again, take 2 cyclocaprin, any sort of a bump, injury, cut, anything that happens, take that. If it gets serious enough, I kind of self-assess and say, look, is this serious enough that I have to go through the rigmarole of going into hospital? Just like Donal was saying, it's kind of building yourself up to go, oh, I have to go through this, because I know if I go into hospital, I'm going to have to spend, I don't know, I'm going to have to be repeating to every single person I meet, I have von Willebrand's. You need to contact the hematology registrar on call, you need to contact the hematology department, you need to contact somebody, I need treatment. I have to keep going with that mantra, and chances are I'm going to be ignored for the most part. It happened only 4 years ago. I broke my wrist, and I'm sitting down with my wrist bent like an S-hook on middle of Patrick Street in Cork, and some kind people nearby called an ambulance for me, sort of asked me if I needed anything, and I'm like, no, you're fine, I'll be grand. I need to talk to the person myself and tell them exactly what needs to be waiting for me when I get into the hospital. Thanks very much, And I kept on saying to every single person in the ambulance, on the phone to emergency services, all the way into the hospital, first person I meet going in, first doctor, first nurse, every person constantly, I need to get Willebrand. There's no cut here, but this is going to be going crazy internally, And it was 2.5 days later I got my first treatment, so it's that's kind of where I am with treatment. Like, it's even hearing Donal talking about sort of general aches from injuries you've had back along. Like, I have a shoulder injury that's niggling and nagging at me that I don't think it'll ever go away. Doctor's unwilling to actually do anything about it because I need to go through a whole process of getting treatment first, getting all of that sorted. And I often get the actually, have you thought about trying something else, like just not use the shoulder? You'll be grand, rather than actually doing something about it. It's difficult going to hospital in Cork with the bleed.
It's all about awareness as well among the healthcare professionals. The same awareness isn't there about von Willebrand's. And also, do you bring your bleeding disorder alert card with you when you go in?
Bring it absolutely everywhere I go.
Okay.
Everywhere I go, flash it like a like a badge of honor. You know, say, look, check me out. And you know, like my own GP is fantastic. He really is. He's been plugged into what von Willebrand is and what treatment is required, and he has fought on my behalf for a long time. But I don't think our local treatment centres is our local hereditary coagulatory disorder unit is as fights as strongly on our behalf. You know. But yeah, it's awareness. Awareness is a huge thing. People sort of think of what I get back. People in the medical community tend to sort of respond with, but it's only von Willebrand's. It's grand, you know.
Either that, or they don't think you should have a condition they can't spell. Okay.
Yeah.
Breda, what's your current treatment?
Well, I'm not on anything. Cyclocaptan again is on hand all the time. I still get nosebleeds, and quite bad nosebleeds, but I think I can kind of, I have to look back. If I take any food or any supplement that has vitamin E in it, I will get, after 4 or 5 days, I will get severe nosebleed. Like, for instance, fresh pineapple, I can't have it. And last year I got a bad kidney infection, and you go for cranberries. So I had dosed myself up on cranberry juice and what have you. Oh my God, what a nosebleed. I got 11 o'clock at night. I thought I would have, even cyclocaptan didn't stop it for a while. I thought I would have to go to the hospital, and then it just stopped. And I checked it out. Yeah, cranberries very high in vitamin E. So I have to check, especially supplements, you know, to make sure there's no vitamin E in it. And I have learned that. So cyclocaptan I would have all the time now, except that I have to go to hospital for an investigation or for something like that. I have to have Willet. And it's the organising of that. Like, you go, I'm always a bit apprehensive going to a new consultant that I haven't been to before. You're just wondering, are they going to take me on, or are they going to say, oh no, I'm not going to treat you? You know, you're just holding tight when you announce that, you know, I am von Willebrand's, whether they'll say, all right, what is it? Or, okay, I know all about it, you know. But, and then it's organising. The treatment is just, it's a slow process, like, you know. For instance, last year I had to go for a colonoscopy, but like, I went to the specialist and he said, fine, that's okay. I'm aware of the von Willebrand. That was great. I was able to relax. He said, I could do you next week. But he said, I'll have to coordinate it with the coagulation unit. So he said, I'll let you know. So 2 months later before I got it. Because trying to organise
But
it.
those
with
lead
the
to delays, yeah.
And it was waiting. And as a result of that, it was kind of over the top, really. I ended up with 2 nights in hospital to have a colonoscopy, which was a bit over the top because it went the other way, just in case I had a bleed. I had to go in the night before, get treatment in the morning, had the colonoscopy treatment that evening, then they kept me overnight in case I had a bleed. And like, I could say to them over, look, I'm only 10 minutes in the hospital. I go, no. So I'd spend 2 nights, so I don't have to go there again. So that's basically it. I would just, going forward, like if there was an easier way to manage all that, but I suppose at this stage it might come eventually.
Okay, thanks, Breda. Shannon, your current treatment experience?
Right now it's only my form of birth control that has been like the best thing for me that I've ever gotten, because it was the only one that seemed to work after been on the pill, the patch, like injections, everything. So far throughout my life I've been really lucky where I've only had to have DDAVP once when I was a baby, when I was a toddler, getting my tonsils out. I never heard of this cytoclap. I never got given that as a kid. I kind of wish I did. It was never mentioned. But that's really it. I'm not really on any treatments. Don't know if it'll happen in the future, but right now, none.
They might have called it tranexamic acid. Same thing,
yes.
different name.
Yes.
Okay. All right. So I'm going to come to Jim in a second. He's his hand up for a while. But I think what's already evident from listening to the 4 of you, it's like talking about 4 different conditions, right? So that's why von Willebrand, in some ways, is so complex, because there's a vast range of symptoms, of severities, of conditions, of bleeding patterns, and that actually makes it's much more complex in terms of diagnosis and treatment than haemophilia. Jim, you have a question.
Yeah, I was just going to comment on Donal's situation with his joints and say it's never too late to start prophylaxis, because of my inhibitor background and stuff, I was never really able to access prophylaxis until emicizumab came along, and I'm 2.5 years now on that. But within 6 months of starting the emicizumab on a regular basis as prophylaxis, I noticed complete change in my stiffness levels in the mornings. And like many others, I'm sure Kieran will bear this out, we are convinced that the microbleeds, which are basically running all the time, are the cause of the stiffness in the mornings. And if you're on prophylaxis, you can eliminate those or most of them. So it would give you long-term protection for your joints. At least they won't get any worse than they are now.
Okay, thank you, Jim.
Thanks,
There's a couple of questions in the chat. What home treatments are available to treat bleeds due to von Willebrand's? There's a range of treatments depending on the type and the severity, from tranexamic acid cyclopentone to DDAVP to hormonal contraception or coils, to plasma-derived coagulation factor concentrate, which contains both factor VIII and von Willebrand factor, and there's also now a recombinant von Willebrand factor concentrate on the market. There's another question, and should anyone getting joint bleeds be on either on-demand or prophylaxis? I think the short answer is yes, and ideally you would think prophylaxis, but that's a process that's ongoing. But in fact, it's only in the last 3 months that those guidelines have come out, talking for the first time about prophylaxis in von Willebrand's, which is really helpful, which I think would be helpful. Can I go on to ask you about, each of you ask you about your hopes for the future? Your hopes for the future of treatment, your hopes for your future of von Willebrand's. I'll start with you, Breda, this time.
Yeah, as I said, I would just really like if there was treatment available that, you know, if you had to have a procedure, that it was straightforward, rather than organizing and waiting. And, you know, I keep saying that over and over again, just to make life a little bit easier, if you have to go for a particular procedure or whatever, you know, rather than at the moment, it is just difficult. The other thing I would say, I had surgery, I had 2 or 3 surgeries in 2012, and I was getting treatment and everything was fine, home for a week, back in again. And somehow or other, the hematologist decided I didn't need any more on a particular, I had surgery on a Wednesday afternoon, and that I got treatment before the surgery at 3 o'clock. And somehow or other, it was decided I didn't need any more that evening, that night, until the next morning I would get some more. And I got a very severe bleed that night at 9 o'clock, and nobody would listen to me that I was actually having a bleed. I was actually had a skin graft in my face, and I knew myself that I was having a bleed. Nobody would listen to me. It was 12 o'clock at night, and from my hospital bed, I was going to ring James's to know could somebody intervene somewhere, and eventually I got Violet at 12 o'clock. But I lost part of the skin graft, and I did a lot of shouting afterwards, and I think that's what people have to do. You have to fight for yourself, really, you know, a lot, which I have done over the years. But at that stage, I just got a screening done as regards my whole levels and what treatment, and there is a plan in place for me now if I ever had to have surgery, and that's something I would recommend for other people, like especially if you're a severe bleeder, that you need a plan rather than Wildlight every whatever so many hours, or I don't know what way it goes, rather than a hematologist deciding, yes, you get treatment now, you don't need it until tomorrow, type of thing, you know. I don't know if that makes sense.
No, that's fine. Just clarifying, Wildlight is one brand of plasma-derived coagulation factor 8 von Willebrand concentrate. And I think you make an important point, Breda, the importance of being assertive without being aggressive, knowing about your von Willebrand and not being afraid to tell the healthcare workers about that and be assertive. Shannon, what would you hope for the future?
I say just more awareness, especially for like type 1, because I feel like just one of the main reasons that a lot of women and girls are not diagnosed, as you said earlier, is that the main symptom for them is periods, and they don't realize that they're like not meant to be this heavy. So I like the fact that it's like 9 out of 10 people are undiagnosed is just disgraceful. Like we need to break this kind of like, no, don't know what the exact word would be like, but break the cycle.
Yeah.
Of people not getting diagnosed. It's disgraceful. Like, Breda, what happened to you happened to my mom. She had a hysterectomy at like 30. It was when I was 8, so when she was in her 30s, and something like that shouldn't happen. Like, the more awareness even within the GPs and the healthcare supporters. Like, even me, when I'm going to my local GP, he still doesn't have a clue what von Willebrand's is, and every time I go in I have to explain it. So more training, more awareness.
Well, a couple of points on that. That's good points. And I think, first of all, just to clarify, in terms of diagnosis, Ireland has diagnosed about 33% of the people with von Willebrand's, which is low, but it's actually the highest of any country in the world, which is really scary. Most countries have diagnosed 10 to 20% at most. We've diagnosed 33%, but it's still low. In terms of GPs, Shannon, I think that's something we've been discussing, and we really need to try and get more information out to them. It's very difficult, because there's no point in sending them booklets or information going straight in the bin or the shredder. So I think what we have to do is walk through people like Michelle Lavin and James O'Donnell, and actually COVID might have helped, because they've now got into the habit of doing webinars with very, very large groups of GPs. James did one recently on COVID-19, and he had 1,900 GPs on the call. So if we can start getting those numbers in, and while they're on the call, talk to them about von Willebrand's, that's a really good way to get awareness going. I think what we have to do as well is work with them to try and what they call train the trainers. There are groups of GPs who train other GPs. So it's really a question of getting the information to them about that and having it trickle down. But the problem with, we could send a booklet out to every one of the 4,500 GPs in the morning. We could send them a poster and a von Willebrand booklet. It would have little or no impact. So what they really need to hear, they need to hear this continuously in their medical training and so on, and their continued professional development classes. Donal, what's your hope for the future in terms of treatment?
My side of it is, I suppose, aimed and pushed a lot towards newborn diagnosis and the way they're tested and how long the test results come back. I think if you have anything, there's a format to everything, and it has to start at the beginning. There's no point starting halfway through and trying to get people, like, don't get me wrong, there's a lot of people out there undiagnosed, and we need to get those people diagnosed. But instead of us pushing to try and get people diagnosed, and where do we start? We should be starting at the beginning. If there's any history in the family of bleeding disorders, the child needs to be tested. Are we going to have to wait for a child, a couple of months old to have a bad bleed and it possibly ruin their life or worse? We need to get that sorted out. There's too many women waiting for children, men and women, mothers and fathers waiting for children and babies to get the results back. Waiting 15 months to get a test result back is crazy. And this country has a long history of doing crazy things. We need to sort this shit out.